During this back to school season, family physicians are emphasizing that vaccines are safe, effective, and save lives. As the number of fully vaccinated kindergartners has dropped almost 2.5% since 2020, family physicians say they have an important message for anyone with questions about safety, efficacy, and necessity for vaccine. Ask us. Today I have Dr. Diana Howard. She joins us to discuss the importance of vaccinations and how to have a productive conversation with your doctor to help you and your family make informed decisions for your family's health. Good morning, doctor. How are you?
Good morning. Thank you for having me today. I'm excited to discuss immunizations today.
I'm excited to talk to you about it. There's been a decline in childhood immunization rates since the pandemic began, and many parents have questions when it comes to vaccines. What would you say to anyone who's on the fence about getting their child vaccinated?
Well, first, I want to emphasize the vaccines work. They are safe, they're effective, and yes, they do save lives. The reality is that most of our population does not remember what life was without vaccines. They have saved millions of lives, they have critically advanced public health. Now, our vaccines have been submitted to comprehensive scientific testing before they even reach the public. And they go through extensive research trials and safety checks. Now, if someone say that they do not want to get a vaccine because their immune system is okay, I would say that when you receive a vaccine, you not only protect yourself, but also you protect the most vulnerable people. We're talking about newborns, anyone who has a weak immune system. We create a community of immunity.
That's interesting. There has been a rise in measles cases across the US. What's behind the increase, and how can parents protect their children?
So now we talk about measles. Let's mention two facts. One, that measles is a preventable disease, means that we have a vaccine that can prevent you to develop severe symptoms, prevent you to go to the hospital and die due to this. Now, second, that measles was eradicated in the US. And we didn't have to worry about it thanks to the vaccine. So after the pandemic, unfortunately, childhood vaccination rates have been falling, and we just opened the door for outbreaks of preventable diseases just like measles. I Unfortunately, we have also many children that were hospitalized, and two of them lost their lives. And it's not because they didn't have access to the vaccine, but it's because the parents chose not to vaccinate them. So parents need to be aware when they choose not to provide a vaccine, is not only putting their child's life at risk, but also the people around them. Now, good news for the parents, we do have the power to protect our children. We have to keep them up to date with their MMR vaccines.
Now, there's a lot of noise about vaccines and health right now in the media, on social media. Everywhere it seems like it's going on. When it comes to vaccines for patients of all ages, how do you help patients separate myth from fact?
Well, as family physicians, we know that our patients and their family, when they come to our clinic, they have their best intentions. They want to do the best for their families. But it is overwhelming and challenging to go all the information that is in the media and just to cut through the noise. Well, your family doctor can help you answer the questions. So we have scientific-based information that can help you make the best decision for your family health. Now, I would recommend you to schedule an appointment with your doctor and bring all those concerns, all the questions you have. We will be there to help you.
We all want to be an advocate for our family's health and do the right thing for ourselves and our loved ones. What questions can family doctors answer about vaccines?
Well, family doctors think we take care of the newborns, we take care of children, adolescents, adults, and the elderly. So we can tell you exactly which vaccines are recommended for each member of your family. We can let you know what is the right time to get it. Example, if we talk about the school begins now, which vaccinations are indicated now, which vaccines are recommended according to the patient's age and their medical history. We also talk about now time for the flu season, RSV vaccines. We can discuss all of them. We can discuss vaccination side effects too that we assure you are mild, and it is just a response of your immune system, means that the vaccine is working. We want you to advocate for you and your family.
Now, for those who want to learn more about vaccines, where can they find additional resources?
Well, the American Academy of Family Physicians have developed really great resources for our patients. We can go to the website familydoctor.org. We have information in English, also Spanish.
Wow. All right. Thank you so much again. We really appreciate you joining us. I've been speaking with Dr. Diana Howard. We've been talking about vaccines, taking care of our children. Thank you again for joining us on Morning Blend.
Thank you. Have a great day.
You too.